Welcome to today's video where we'll be discussing a rare but significant condition affecting the urinary system, bladder amyloidosis. We'll explore what causes it, how it affects the bladder, its symptoms, diagnosis, and potential treatment options. Let's dive into understand this complex disease. The underlying cause of bladder amyloidosis is the deposition of amyloid proteins in the bladder wall. Amyloid is an abnormal protein that, under normal circumstances, isn't found in the body. However, in certain conditions, these proteins misfold and aggregate, forming insoluble fibers that deposit in various organs, including the bladder. The most common type of amyloid protein involved is amyloid light chain, or AL amyloid. This is associated with plasma cell disorders. Other less common causes include amyloid amyloidosis, associated with chronic inflammation, and rarely hereditary amyloidosis. The pathophysiology of bladder amyloidosis centers around the accumulation of these amyloid deposits within the bladder wall. These deposits infiltrate and disrupt the normal architecture of the bladder, replacing healthy tissue. This infiltration thickens the bladder wall, reducing its elasticity and capacity. The deposits can also damage blood vessels within the bladder, leading to bleeding. Consequently, the bladder's ability to function effectively as a reservoir for urine is compromised, leading to various symptoms. Epidemiologically, bladder amyloidosis is considered a rare condition. It's difficult to determine the exact incidence and prevalence due to the challenges in diagnosis and the fact that it often occurs as part of a systemic amyloidosis rather than an isolated bladder condition. It tends to affect older adults more frequently, with most cases diagnosed in individuals over the age of 50. The specific prevalence rates may also vary based on geographical location and the underlying causes of amyloidosis in different populations. The signs and symptoms of bladder amyloidosis can be varied, depending on the extent of the amyloid deposition. A common symptom is hematuria, or blood in the urine, which can range from microscopic to visually apparent. Patients may also experience irritative voiding symptoms, such as urinary frequency, urgency, and nocturia, which is the need to urinate frequently at night. In some cases, patients may experience suprapubic pain or discomfort. In advanced stages, reduced bladder capacity can lead to difficulty storing urine and increased urinary frequency and urgency. Diagnosing bladder amyloidosis typically involves a combination of clinical evaluation, imaging studies, and ultimately, a tissue biopsy. Initial evaluation may include a urinalysis to detect hematuria and a cystoscopy, where a small camera is inserted into the bladder to visualize the bladder lining. Imaging studies, such as CT scans or MRIs, can help assess the thickness of the bladder wall and rule out other potential causes of the symptoms. However, the definitive diagnosis requires a bladder biopsy, where a small tissue sample is taken and examined under a microscope for the presence of amyloid deposits. Special stains, such as Congo red, are used to confirm the presence of amyloid and differentiate it from other substances. While bladder amyloidosis doesn't have distinct subtypes in the same way as some other diseases, it's crucial to understand the underlying cause of the amyloidosis. Bladder amyloidosis is classified depending on the type of amyloid protein involved, such as ALA or hereditary. Knowing the specific type of amyloid is important for determining the appropriate treatment approach. Treatment and management of bladder amyloidosis aims to alleviate symptoms, slow the progression of the disease, and address the underlying cause of the amyloidosis. Symptomatic treatment may include medications to manage urinary frequency and urgency, as well as procedures to control bleeding. If the underlying cause is AL amyloidosis, chemotherapy or stem cell transplantation may be considered to target the plasma cell disorder. In cases related to chronic inflammation, addressing the inflammatory condition can help slow amyloid deposition. Unfortunately, there are currently no specific treatments to reverse the amyloid deposits once they have formed. Management is often multidisciplinary and involves urologists, hematologists, and other specialists. Currently, there are no specific measures to directly prevent bladder amyloidosis. However, managing underlying conditions associated with amyloidosis, such as chronic inflammatory diseases or plasma cell disorders, may reduce the risk of developing amyloid deposits in the bladder and other organs. Maintaining a healthy lifestyle, following medical advice for managing chronic conditions, and seeking prompt medical attention for urinary symptoms can help with early detection and management. The prognosis of bladder amyloidosis varies depending on the extent of the disease, the type of amyloid protein involved, and the presence of other organ involvement. Localized bladder amyloidosis may have a more favorable prognosis than systemic amyloidosis. The prognosis is heavily influenced by the underlying cause of the amyloidosis and the response to treatment of the underlying condition. Ongoing research is focused on developing new therapies to target amyloid deposits directly and improve outcomes for patients with amyloidosis. Research includes developing antibodies and small molecules that can break down or prevent the formation of amyloid fibrils. Clinical trials are also exploring the use of novel imaging techniques to improve early diagnosis and monitor treatment response. Thank you for joining us today.